Hi everyone, Veronica's back, and I'm here with my lovely, lovely friend Barbara Eichhorst. And some of you may know her. She is a specialist and expert in the diabetes education arena. She's a master's prepared diabetes educator. She's a master's prepared dietitian, certified diabetes educator. And she has a ton of just great experience. She currently works with Voluntis, which is a digital healthcare company, and they offer a insulin titration application for the phone. But before that, she worked with Healthy Interactions for 10 years. And they are the creators of the diabetes conversation maps. And she was the main training developer there, and actually trained healthcare providers in over 120 countries and has visited over 60 countries. Mm-hmm. So, and has visited over,
because we're at ADA.
Yeah, so we are live at ADA,
exactly,
which is so exciting.
We try to find a quiet space, but then everybody's speaking and want the quiet space for themselves.
But even before Barbara transitioned into industry, she actually worked with the American Association of Diabetes Educators and was a clinical dietitian at some top renowned medical facilities in Chicago, where she's from, including Rush University Medical Center, Northwestern, and also Loyola. And she also volunteers with National Certification Board of Diabetes Educators, does still patient education. She has her hands in a lot of areas. So
I like
thrilled.
diabetes.
Yes. And she's one of my mentors as well.
And friends.
Yes. But I invited Barbara back for a multitude of reasons. One of them is because she recently presented at ATTD in Berlin on providing a solution for diabetes educators on insulin titration. What I will say, quick disclaimer, I am a diabetes educator, but I do work for an insulin pump company. Any of the opinions or views that we represent or that we state on this video do not represent who I work for. They're my own personal views. And then if we do give any type of tips or advice, please make sure that if you are a person with diabetes, please make sure that you consult with your diabetes educator or your physician. Do not use this as therapy advice. So Barbara, let's go ahead and let's talk about this paper. Because I know that, tell me a bit about what is, I guess, the problem that you saw happen with diabetes educators and titrating insulin.
So my focus is on management of type 2 diabetes with insulin and effective insulin titration. Mm-hmm. So there's a new clinical practice guidelines in 2018 that state that people who are starting insulin or managing their type 2 diabetes on insulin need to titrate. And what we know is that a significant amount of people with type 2 diabetes taking basal insulin are not able to meet their goals. Glycemic goals. So, and part of the reason is that it's not as easy to titrate the insulin. That means, adjusting your insulin on a daily basis to respond to your fasting blood glucose if you're working with basal insulin or other insulin. So what we know that the challenge is that people who are taking basal insulin majority of those people are not able to meet their glucose levels. So that's
and I think a lot of diabetes educators, if you're watching, you realize too that they can't call you every day so that you can give them that advice, or they can't see the provider every day to get that advice. That's why it's important to teach that self-management.
Exactly, and I'm a diabetes educator, you're a diabetes educator, and typically as diabetes educators, we're more involved with helping people to titrate their mealtime insulin, carb to insulin ratio and so on. We're not that involved with basal insulin. So we ask, is your doctor titrating you? A patient will say, yes, I have a titration strategy, and we leave it with that. We know that as diabetes educators, so we are helping people to change their habits, daily behaviors. So it's an opportunity for us, for diabetes educators, to actually have a conversation with people with type 2 diabetes who are on basal insulin to how are you titrating? What is your titration algorithm? What technology do you use? Because there's a lot of different apps, there's different technologies that people are using, and inquire about it because we can learn from people with diabetes who are using those technologies and also help them to address the challenges with it. So what I did is I did a paper, not a paper, but a poster, and then the title of the poster was How to Incorporate Insulin Titration into Diabetes Education. So as diabetes educators, we know that there is 7 AADE, 7 behaviors, and we can incorporate it into
Medications.
Exactly.
Or monitor.
Exactly. So, even as we are both dietitians, we're talking about food as well. You know what I mean? So, so all of those discussions, how are you titrating insulin, can fall into that. Another learning from my poster was the remote monitoring. Now we have, after we see people with diabetes, and for those of you who are watching who are part of providing DSME, Diabetes Self-Management Education and Support with ADA or AAD recognized programs, you know that we have 10 hours that we can provide for diabetes education, and after that we have 2 hours of ongoing support for people with diabetes. So there's many opportunities to identify people who are taking insulin, and then help them to titrate effectively. And oftentimes when you think about insulin, it brings people back because people, especially with basal insulin, are afraid of low blood glucose. They might be afraid of titrating up because they're afraid they're going to hit the low blood glucose. So our contribution could be to educate them about the risk of low blood glucose and for people to not to feel afraid. And now with the use of a digital FDA cleared technologies, it's safe to use it. Some of them are prescription, some of them are not prescription. So people have different resources now that they can use to safely self-titrate. And the key is self-titrate because we're doing it on their own.
Yeah, I think that's wonderful. What I envision happening is I think it's also going to open the dialogue for you diabetes educators with those providers, because I can just imagine in my experience, if I'm sitting down with someone and I'm asking them, how are you titrating your basal insulin? I bet you about half of them don't even have a titration plan in place.
Yes.
So then at that point, you can then schedule a follow-up and you can work with the provider to see what they like to see in their patients on basal titration, and now you're starting to build that rapport with that provider if it's someone that you don't usually communicate with, which will hopefully then build more referrals to you as a diabetes educator, and then you're just working more effectively in conjunction with those providers and then being able to give those patients the proper treatment and titration plan as well.
And now when you said that, it reminds me when I used to actually work with insulin titration on the HELP project in Chicagoland.
Okay.
And it was to help clinicians to do titration, to know how to do titration, and then directly with people with diabetes to self-titrate. So maybe 15 years ago. Anyhow, I thought I knew self-titration. But I didn't know the technologies. So what's happening is that when people used to, pen, so they have to calculate, and we all know that there's an issue with numeracy. Increase 1 unit every 3 days or 1 day based on your average of 3 days. It requires skill sets and thinking process. So sometimes the difference between 1 or 2 units is just easier not to increase it because I just don't feel like calculating it. You know what I mean?
Right.
So now when we have different technologies, so if you are a healthcare provider watching it, I encourage you to explore those because people with diabetes are exposed to those. And then now when we know the new clinical guidelines indicate that people who are starting insulin or taking insulin need to be instructed on the titration strategy. So patients will be asking us for that.
Right.
And then if you are a person with diabetes watching it, it's the same thing. It's kind of when you're taking insulin, talk to your providers, talk to your diabetes educators about titration. Are you meeting your goals with the existing dosage, and if you need to increase it, how you're increasing it, and then what technologies or what strategies you can use to help you with effectively increasing it without with minimizing the risk of hypoglycemia.
Thank you, Barbara. Are there any resources that you would like to recommend or even discuss as options?
I think it's just a matter of educating yourself. You can go, actually Dana, AADE, has a great a website where they look at different products, FDA cleared devices and other apps that people are using, and they're able to rate it. So I would probably direct you to Dana, because I don't think that there's any other place that has such a comprehensive
Yeah.
review of the existing technologies. I know that Dana is available only for the AADE members, but I think there are some aspects of it that is available for general public.
Right.
So that's what I would direct you to. Or ask your, if you're a person with diabetes, ask your diabetes educator and your doctor about this. The key is we want to talk about titration. So once you open that conversation about titration, because we know that, as you said, the challenge is that people are not meeting the glycemic goals while taking insulin.
Yeah.
So it's a matter of like maximizing insulin, making the best out of your insulin dosing without a risk of hypoglycemia. So just make sure that you start that conversation, and that I think that conversation is going to guide clinicians such as ourselves to look what resources we have available to you, and then and help you choose the right thing to support your titration process.
Thank you, Barbara. I think this is very powerful because, again, I remember as a diabetes educator myself, I never really necessarily asked about what is your, basal insulin plan, and how are you going to be increasing it or decreasing it based on your blood sugars. So I think, like she said, definitely have those conversations, and especially as more and more of us are getting involved with automated insulin deliveries, we're getting more comfortable with insulin management, with pattern management, and this just is part of the package as well.
Exactly, and it's also almost like a forgotten population, because we as diabetes clinicians, we focus so much on the fancy things, insulin pumps and continuous glucose, which is amazing, but we're forgetting the basic of basal insulin titration.
Right.
And everybody starts with that with type 2 diabetes, you know what I mean? So it's kind of like a stepwise approach, you know what I mean, as well. So it's oftentimes you might feel overwhelmed about the very fancy technologies, but just simple technologies, and then grow your knowledge about it. It's not really as scary as it seems.
Right.
Yeah, there's we all are complementing the unique needs of an individual. So there is enough of technologies and enough of resources for people to really choose what fits best for them.
Great. Well, I look forward to having Barbara back, I'm sure, in the next few months on several other topics. If you have any questions, please post them below. And thank you for joining us. Thanks, Barbara. Bye.
Bye, everybody.